So if you have seen, if you recognize these individuals in the black and white picture, it doesn't go back to black and white. I don't know why my image came through black and white, but this is the Love Boat. I enjoyed watching that as I was growing up. And so I'm going to tell you why that image is here. It isn't that I'm telling you as a caregiver, you can take a cruise, just take a break, you need a respite, go on a cruise. I wish I could tell you that. And maybe you can use that as a way to fill your cup. Maybe that is a lifeline for you, but obviously that has a lot of cost to it, including time and planning and expenses. So not always feasible, but I'm going to tell you why I like this image of the team that works on this cruise, the Love Boat. So one of the things I think, and you may be able to check off things on this list right now. What are you involved in as a caregiver for an older relative? Are you involved in managing wounds, or catheters, or a lot of complex medical tasks, which you probably didn't really receive any training for? It was kind of on the job training. I would guess many of you are not nurses where you came into this caregiving task already having had healthcare skills and experience. Are you managing calendars that are probably pretty complex because it's not just your loved one's calendar of appointments, but yours as well and other family members? How about handling meals, medications, which we know can also become very challenging and complex? And the list goes on. So I was asking some family caregivers in a class that I offer about um, what are some words to describe what they do. And I had an individual write down, I feel like a taxi driver. I'm driving my individual to a variety of appointments. And someone else said, I feel like I just live and die by the calendar and what's going to happen on the next day and how to get prepared for it. And so as folks were being very honest and real about how they kind of describe some of their key roles in caregiving, one caregiver came forward and she said, I've got two words for you. I'm the cruise director. And I just thought that was really fascinating. And so we stopped and said, well, tell us what that means. And so she said, well, I'm doing the things that you all are doing. I'm helping with transportation. I'm helping manage calendars. And sometimes I feel like Julie from the Love Boat with my clipboard. I'm providing entertainment. I'm coordinating meals. I am providing emotional support. There's always some challenge on the Love Boat, some relationship issue, and the team has to kind of come around as a staff and help resolve these issues conveniently before the cruise comes back into port. And so she just said, I really feel like I'm a cruise director. And she was caring for her spouse. And she didn't say it in a negative way. It was just, she kind of said, I feel like I really should carry around my clipboard, have my kind of captain's hat on, because this is the way I'm kind of describing to others how all encompassing my role as a caregiver is. So maybe you need to think about being, are you a cruise director, and are you helping coordinate these things? And not that we're trying to put a positive spin on something that could be really challenging. I just wanted to pass along that was the way that she presented this to this class. Okay, so that may not have been a all-inclusive list. You may have other things you would add to what you're doing as a caregiver, but I also keep in mind as somebody who does research into caregiving, okay, you're managing those tasks that we just listed. You're also probably working. So we know that 2/3 of persons who are caring for an older relative are also working part-time or full-time. Is your employer aware of that? Is your employer supportive of that? And let me start with an example right here within Riverside Health. Our health system employs about 10,000 persons. And we estimate from some of these surveys that we've done that at least 20%, probably more like 2,500 individuals out of the 10,000 people who work in our healthcare system are caring for a family member, likely an older relative. What are we doing from our employee assistance programs, employee engagement groups? What are we doing to help not only recruit new members to the healthcare system, but retain the ones that we have when they're trying to juggle between working in our healthcare system and providing care personally? Maybe helping care for other family members. So we know in at least 1/3 of all caregiving situations, the individual that maybe you is not just caring for one family member, but another. I know one of you shared that in terms of caring for both parents. So again, it isn't always as simple as thinking, oh, there's one caregiver, and for every caregiver, there is one person they're caring for. It's more likely there's more than one. And perhaps It's a sequential so that they may complete one caregiving role and then step into another caregiving role. Maybe you're managing your own healthcare needs or challenges. Maybe you're engaged with a civic or community organization that's very meaningful to you, or engaged in a religious organization, or all of the above. So again, you may have checked off everything off the list on the previous slide and this one. It's a lot. How do you manage the balance? Okay, well, then you need to fill your cup. And again, I don't want to sit here and say this is so easy and you could be doing better taking care of yourself. I am not in a position to do that. And in fact, I have had caregivers really push back and say, don't tell me I need to take care of myself. Of course, I know that I need to. When am I going to do that? How am I going to do that? So I just want you to think about strategies. And it isn't let's take a cruise for a week. That's probably not a realistic way to fill our cup. So, well, I share this image, perhaps somewhat selfishly. This is an image that my son drew of a cup when he's getting ready to graduate high school in June. And this was when he was in second or third grade in elementary school. And the art teacher asked them, just gave him a pencil. I want you to just draw a cup. And she had put a coffee cup up at her desk. And she said, can you please draw this? And so he drew this. And then when he came home, I guess he didn't like that it came home in his folder. He didn't like what it looked like. He crumbled it up and he threw it in the trash. I happened to pull out the trash and found it. And I opened it up and I said, this is really neat. And I think we could learn something from this. And so it became my filling your cup image is his. I don't know how appreciative he is that I'm still using this, but I like celebrating that this was an image he used that really spurred me on to be more of an advocate for myself as a family caregiver and for all the family caregivers that we support here through our role. So so I think you do have to be careful. I would never want to say to any of you and would encourage you not to say to the caregivers that gosh, it really looks like you're kind of out of balance. You need to kind of get things back in balance. Drawing that to someone's attention is probably not that helpful. But what happens when you do feel out of balance? And you know what that gut feeling is that I have to say no to something. I've said yes to too many things and I've got to step back a little bit. And I do really want to challenge you to not just ask for help, but to then be open to accepting the help. And I'll tell you why. And we just had a colleague here of mine visiting from Philadelphia. He's a longtime counselor and family therapist for family caregivers. His name is Barry Jacobs, and he is built. I connected with him through the Rosalind Carter Institute. He and I both have worked with our former First Lady on caregiving initiatives before she passed away, and he talks about how receiving help is a gift to other people. Because if we are offered help and we don't accept it, no, thank you, I got it, I don't need it, thanks, I got everything under control, whether we do or not, then those offers of help don't tend to continue to come. Because if I'm offering it, I think, oh, well, you turn me down, you decline this, you don't need it, I guess you're doing okay. So would just think about the fact that you're giving a gift to somebody else by accepting that help. You're probably not asking them to come in and do something very personal like bathe your loved one. But I would encourage you to have a list ready of some simple things you could do when someone says, how can I help you? And I also would encourage those of us who are supporting caregivers to not say, how can I help you? But here's how I'm going to help you. And giving something very tangible. I actually notice you've been really busy. You've shared your calendar's been very full of medical appointments for yourself and your loved one. I thought I might help. I'm making extra spaghetti. And tomorrow night I'm going to drop off spaghetti. Would 6 o'clock be okay, or would 6:30 be a little better? Okay. And hopefully you see how that's really different from me saying, what can I do for you? Because now that then puts it on the receiver. And I think, well, I don't know. I got lots of things you could do. I don't even know where to begin because I don't have my list ready. But if I'm the one that's making the offer to a caregiver and I can be much more tangible about, hey, I'm going to be near your neighborhood tomorrow night. Weather looks good. Could we meet? The light, it's longer, daylight's longer now. How about we go for a walk at 7? Will 7 work for you? I just want 30 minutes of your time to kind of let's both get some fresh air and you can give me an update. Or again, the example I gave with I'm going to drop off the spaghetti, is this time okay? Instead of can I bring you dinner, or when can we get together, or what can I do for you? Which, not that those aren't genuine offers, but they're just not as tangible as we might need as a caregiver to really be able to be open to and accept that help. Okay.
We have a comment,
Go ahead, please.
yeah, in the chat that from Margie. I love the idea of having a list ready.
Okay,
So
good.
yeah.
Good. So work on that list, Margie, and it doesn't have to be long, but it could be, would it help if somebody picked up the dry cleaning? Would it help if somebody picked up groceries or dropped off a meal or sent you a card or sent you a cheerful text? What are some simple things that you can have ready that you can ask folks that I assure you most folks are going to say, thanks for, sure, let me do it. They're honored. They'd be honored to be able to be in that circle with you and do that. So with the third bullet that I have there, and one of you mentioned an example of partnering with your sibling on providing care. So, it's never going to be equal. Let me just say that with family members. There's probably going to be drama. There's probably going to be somebody who steps forward and does a lot more than others. And I can't tell you that that sounds fair, because it probably isn't, but it's probably not ever going to be fair. So I think thinking about what are the limitations. Some of you mentioned some relatives live nearby, some live further away. Some might be embarrassed about what's happening with their family member, or they don't know how to help, or they assume because you step forward, you've got it all under control. So I guess set some limitations or some understanding for yourself about how not everybody's going to contribute equally in this. But one of the things we're going to talk about in a few minutes is how you can build a care team, and how that team may be beyond who your immediate family members are, and to think a little bit more openly about that. I was at a conference last week where it was a therapist who was presenting, and he was talking about saying yes to no. And I'm going to start borrowing that phrase, that sometimes we're giving. We wouldn't be caregivers and in this role professionally or personally if we weren't just givers and doers. And I applaud you for that. But I do think there's times, and I'm one of the first ones that knows I need to do this, to just go, okay, did I say yes to too many things? I thought it sounded good at the time. And so I'm going to start giving you permission, and you need to do this for yourself and others, to say yes to no, and to be okay with that. And you're not saying no forever, but you're saying no right now to this. How can you take time out during the day? Ellen started the webinar by saying how beautiful it is outside. And so I'm looking outside my window, actually right here. And so when this webinar is over, I'm going to go out and walk in our parking lot and get some fresh air. So how can you take some time out just for you? It could be very brief, to just catch your breath, do a meditation, listen to your favorite song, that will just help you get a little time out and a break. And then, do you know your triggers? And I don't have time to go into a lot of detail with this, but you can make a separate list of the things or the people that really frustrate you in your caregiving situation. And some of them you may not be able to get rid of, either the duties or the people. But knowing what those triggers are can help you be better prepared, so that you, again, set some realistic expectations, and you're not finding yourself so frustrated. Oh my gosh, they did this again. They said they were going to help out. They said they were going to give me a break, and here they are letting me down again. Again, to try to be realistic about some of those.
Christy, we had a
Yeah.
comment. We have a comment in the chat when you were talking about the siblings and the family. No kidding, from Courtney. It will never be equal, but all sarcasm aside, it's nice for someone else to say that it's not equal. And I'll just want to share very, very briefly, because it's just hit me when I was reading Courtney's remark that when we were caregiving for my dad, he lived near my sister in San Antonio, Texas, and I would come down and relieve her, take dad to the art museum, take him out for lunch. And one day she just looked at me and she said, you're like the Disney dad. It's really frustrating. You just fly down here, you take dad for all this fun stuff, and I'm going to all the medical stuff.
Mhm. Well, but what you were doing was meaningful and helpful too. So, and
Yeah,
what you could do, it was what you could do, right? Based on the geography.
exactly.
So, yeah, great
Exactly.
example. Great example. So, I'm going to remember that, the Disney caregiver that kind
Yeah.
of gets in and provides the entertainment. So,
Yeah.
well, I want you to be thinking about what you can bring to the table, what you already are. And again, you probably aren't giving yourself credit, but these are probably resources you already have internal to you that you can continue to use to refill your cup that can be a lifeline. And we're not going to go through all these in detail. But I did give you the image. I think this is lovely. I would love to be sitting on the beach with the sun rising or setting, doing my meditation or my yoga right there. So again, may not be realistic, but there are some real simple and inexpensive and not very time consuming activities that we can engage in that are what one of my colleagues called soul aerobics. What have you done to exercise and nourish your soul? That's just another way I think of saying what's the lifeline? How are you filling your cup? And so I just gave you some examples of these. I have found in working with caregivers, many would appreciate if I handed them a journal. And I'm not saying this is another task that you got to go write something down. No, this isn't homework, but it might be a way to start or end your day or both by just being thankful for getting through another day, for keeping your loved ones safe, for getting through a medical appointment, even if you had a 2-hour wait before you were able to even see the doctor. Um, but we're also doing an activity here in our office because we are immersed in caring for older patients and their families all the time. Sometimes we need to step back as professional caregivers and take care of ourselves and pull in our soul aerobics. And one of the ways we're doing that is through some coloring. We have a big mural on our wall that we purchased. I think it was $10 from Amazon. It's an image of a tree. And we brought in markers and we each just go into our break room whenever we think about it or we need a timeout and we color. And I have found that to be so rewarding. And now we're also able to invite caregivers and patients who come in who might be a little concerned or nervous waiting on their appointment to also engage in coloring. So while that might have been something we grew up thinking was only for little kids, huge opportunity for us as adults to fill our cup with coloring. Gardening might be more, or something out in nature might be more of your style. So, what is it that brings you joy? What could give you an opportunity to do a timeout, and where would it be? And again, it might not be that cruise, it might not be that trip to Hawaii, but what even for a few minutes could you do? And I would also encourage you to take that one step further. Not only make that list, put a few things on your calendar. Because I know for me, when I put it on my calendar, I hold myself accountable to it. So if I'm going to go for a walk, if I'm going to go to my exercise class, if I'm going to meet somebody for lunch, I'm going to put it on my calendar. And then I do my very best not to cancel it. And I'm going to hold myself accountable to that because that's a part of my soul aerobics. All right. So I want to talk for a few minutes about going to caregivers. One of you mentioned that you lead a group, and others of you may have experience with attending a group or you've thought about it. So I just want to kind of set the context for this. But the social support that you can find by leaning on other people can come from a variety of different places. It doesn't have to come from attending a caregiver support group, but that's one example that I want to share with you. But having a support network, it may be people you work with, whether they're involved in caregiving or not. It may be folks in your church or religious organization, a civic organization, your neighbors, your family members, even a nurse at the doctor's office could be providing you with social support and cheering you on. You hadn't even thought about it before. And look at some of the benefits. Having these connections helps reduce isolation and loneliness, which we know was such a serious issue during the pandemic. Being around other people, they start sharing examples with us. And now we learn about some of their coping strategies that we can borrow and try ourselves. They validate us. I hear you. I don't have all the answers, but I know what you're going through, or I can relate to it. It builds our immunity. It's good for us physically to be around individuals, and it's particularly good for our mental health. Because again, I have somebody else is kind of looking out for me and checking in, and this can help reduce anxiety and depression. All right, so just thinking about, and I've led different support groups. Some have been kind of short term where they had a certain start and end time, and others have been kind of once a month, kind of ongoing. I have a feeling that Ellen probably and the Aging Together team tracks a lot of those. So if you want to know when and where they meet, you can reach out. But let me just kind of set the context for them. Most of these groups are not medical. In other words, I wouldn't expect to go for medical advice. I'm going because I need some social emotional support. I need somebody who gets it. And often, and you may have said this yourself, I know I said this in some of my caregiving for family members, like, I'm just not sure anybody gets this. I feel very isolated and alone. And while that can feel like a very true statement, there are other people who can be supportive, who do get it. You want to be in a group that is, confidential, that the facilitator says, I want you to feel comfortable sharing what you're sharing. I'm not going to judge you based on the fact that you said you just felt like you wanted to wring the neck of the person that you're caring for or a family member who didn't jump in to help. I want you to feel like this is a safe setting where you can share this and that this is not going to then leave the room once we exit. This would apply for both a virtual group and in person. What's the setting like? And do you feel comfortable going to that setting? So if you look at a list of caregiver support groups, they're going to let you know whether it's virtual, which might be what you need, and you can join from your desk at work, or you can join from home, from your couch or in your pajamas. Or is it at a church? Is it at a senior center? Is it at a library? Is it at a long-term care community? And any of those places, I would hope, would be accessible and comfortable for you to come in. But you also have to think about the time of day and the day of the month, when these would meet. Is it led by a facilitator who's been trained to deliver this? Um, or is it a peer or both? I think I'd want both. I'd want somebody who's got some training and understanding group dynamics, but also somebody who's kind of been there, done that. And that's often what we find in Alzheimer's Association sponsored groups. One group here in the Williamsburg area that I know of at a church, at a Presbyterian church, where they decided monthly was not enough. And they're going to meet weekly. Is it in person? Is it virtual? Again, benefits and challenges to both of those to think through. Is it a group that's disease specific? So if I'm caring for my loved one with a type of memory loss, is this a memory loss support group or Alzheimer's group? Or I'm caring for somebody with Parkinson's or they've had a stroke. Those are all groups that are accessible, cancer care. But is that what I want? Or is it that I want something just more generally available? And then does it matter if I'm the spouse, the adult child, a friend, a volunteer, a professional? So that's the type of caregiver. And then do I bring my loved one or the person I'm caring for with me or not? Most of these groups, the care receiver, excuse me, is not included, not because we're trying to exclude them, but we're trying to create an environment of social emotional support for the caregiver where they can be and say and do what they need to do that they may not be able to do when the person they're caring for is present. And one program that we have started offering, actually, we've been now 10 years offering a memory cafe. I don't know if there are memory cafes in the Aging Together area. Ellen's nodding her head. We have 5 that are in our health system territory, and those are designed so that you're coming together with the person who has memory loss, and you kind of leave the diagnosis at the door and you walk in and you've got this social environment. It's not really a support group, but just meant to be a social setting where you can just have a good time, have a cup of coffee, have a snack. It's kind of like what we call the Starbucks without going into the loud fancy ordering Starbucks, but you really can have time to just be together, and both of you can have time to be out of the house and doing something social.
We've had some in our region, and honestly, I'm not aware of any going on right at this moment, but I will
Okay.
certainly find out. Yeah.
Okay. And I do know that George Worthington at the state was trying to
Yeah.
track all of the memory cafes. I think the ones in Richmond are called friendship cafes. They might be slightly different. There is also a national directory through Massachusetts that's kind of kept a directory of all the memory cafes.
Thank
Would
you.
be worth exploring. And that's not the only way. Sometimes we have caregiver support groups where they are joint. We're getting ready to offer a program that starts next week. That's a 7-week course, and it is a parallel program. So caregivers are in one course in one room, and the persons living with memory loss are in another room down the hall. And they have similar learning, but they can do it where they can come together to the same time, have a little bit of a snack, and then get started, but then have their own environments that they're in. So those are things to kind of explore and look into. How do you find out about support groups? Well, again, in your area, I would start with Ellen and the team at Aging Together, but we notice here We put together a master list of caregiver support groups, and we come through a whole variety. It used to be the newspaper had the listing. That isn't so much the case, but we're looking through websites. We're partnering with PAA, which is our area agency on aging. We're looking through newsletters that churches and other libraries and senior centers and rec centers put out to try to kind of find out where are these groups, and then putting them on a master list. I also wanted to share with you two particular apps that I like for caregivers. Now, there are lots of apps out there. So, and I don't get any, I'm not trying to endorse something over another. You may know of others, put some in the chat if you've had good luck with them and you like them. But Caring Bridge and Iana Care are two that I have found that have been particularly valuable for me personally, I've used, and to share professionally. All right, so let's talk for a little bit, and I do want to watch my time here, but continue to come in with the questions. Thank you, Ellen, for popping in with those. I do want to think about two more things here before we wrap up, and that is, what does it look like to have a care team? You might have a care team and you just haven't called it this before. And then I want to wrap up with thinking about more of, we've talked about some personal resources, and a care team is a personal resource, but then kind of moving our way into thinking about the other community resources. And again, keeping the door open, having that lifeline like that life jacket, and filling our cup, whatever kind of metaphor most resonates with you. So, thinking about yourself as the caregiver, if you were in the center with the person that you're caring for, and we know you're always putting that person at the center, even more so than yourself, who would surround you? And again, this isn't so much about the number of people, but kind of who do you know you can call on, you could count on, to be of help and support to you. Now, I hope they're going to reach out and offer help, like we've already talked about, and that you'll be open to accepting that. But there may be individuals you need to reach out to specifically and say, if I ever get in a bind and I can't take my loved one to a doctor's appointment, could you help with the transportation? Or I need you to sit with my loved one so that I can get out for my own medical appointment. Or I need your help with this calendar. The calendar's gotten out of hand. Can you help with that? Can you help with meals? I'm struggling with their medications, so be thinking about, are there areas you're having a challenge where there might be somebody else you can lean on? All right, so who could the care team members be? Anything from your family members, neighbors, coworkers, volunteers, and a variety of professionals. So I want you to think real broadly about how your care team, and it isn't that your doctor's at your beck and call and you can call them or text them at any time, but these are individuals that when you need something, you can reach out to. And you may even want to make a list. Who's on my care team? And again, I'm not trying to get you to put 20 people on the list. I'm just thinking about even 5 to 7 individuals that both professionally and personally you could pull in, and that can be of help to you, because I don't believe that caregivers can do it alone. And I'd like you to be open to thinking about that. And I'm not saying you're not doing a fabulous job, and there aren't probably many days or months or years where you felt like it was you or not or no one. But I'd like for us to think about being a part of a care team. And I can tell you that within our healthcare system, we have the same discussion with our providers, with our physicians, to say the caregiver who's coming with your patient, the person receiving care, and that caregiver, they see you on their care team, and we want you to see the caregiver as a part of the care team. Don't leave them out of this. So it's another way for you to continue to advocate for yourself in partnering with healthcare. Okay, so start with a list. Who would be the individuals that can be on your care team? Okay, have a family meeting or pull in others that you want to include, including neighbors or friends or coworkers, and but first starting with the family to think about, okay, you know, who's helping us with this? And I'll give you a quick example with my husband and my father-in-law that I mentioned that passed away about a year and a half ago with mixed dementia. My husband is one of 4 siblings, and we lived an hour away from his father, and the other 3 lived within a few minutes. And regardless of where we lived, they each have a different relationship with their father, and they each had a different view about what they could contribute and when and how and why, and whether that had an expense to it, time wise or. But I was really impressed to see that they did come together and they started a text string. So they have something called the sibling chat. And during my late father-in-law's kind of journey into late dementia and hospice care, and then since then, they're managing the estate now, which has not been a very clean process for a number of reasons. I've just been really impressed, kind of sitting back and saying, wow, that nothing about this necessarily seems equal. My husband became the estate kind of convener. But they have really kind of all stepped up in their own unique and important way to kind of think through how they can do this, but not just alone, not just them as a family, but who else they can pull in. And I think for them, the most important thing is this chat that they have going via their cell phones, because it allows them an easy way to communicate with each other at any point in time and be aware of the challenges, the frustrations, what's going well. Okay, talking to your physician or your loved one's physician. I count you as a part of the care team. Who else do we need to have? Do you think my loved one could benefit from physical therapy or occupational therapy or speech therapy? Do we need home health in? If so, can you write the orders for that? Again, really thinking about and being prepared when you go in for these appointments so that you're advocating for yourself, but advocating for your loved one. So, um, I would encourage you, as you make a list for a care team, if you're open to trying this out, that you then let these folks know. So don't have them be surprised that you call on them at the last minute and go, I need your help with transportation. That you plant the seed for some of these things in advance. And it could be that they're helping, you've asked them, your yard is so meticulously maintained. Could you help me out or help my mother out? Because you just seem to have a real knack for that green thumb. Can you help manage some of the bills? Or the meals or calendars, or just reaching out to me or my mother and sending us a good word to kind of cheer us on. Any of those are really important roles that a care team could take on. Okay. So let's move on to some resources here. And again, I don't have an exhaustive list, but I have my go-to resources. So that if I were approached by someone who said, I'm in a bind and I really need help right now, where do I go? I don't want to give them 15 resources. I want to give them 2 or 3 to get started. Okay. Down the hall here in my office, we do have a resource room. Ellen, how do you communicate resources out to folks that could benefit?
We have the one and only regional resource guide for older adults in our region, which is about a 96-page resource guide for our 5-county region. And that is also, in addition to hard copy, it is also available online. And then our website also has a lot of listings.
Okay. And you said we can go just to agingtogether.org to get to that regional resource.
Yep.
So I listed that here. Um, and then Encompass, which is your area agency on aging,
Yes,
correct? And
and Janelle is on the line from Encompass, and we work very, very closely with them.
fabulous. So you can see I put area agency on aging
Yeah.
at the top.
Yes.
And I mean, that really would be one of the first places we're
Yes.
thrilled when folks reach out to Riverside and our center. I'm sure you're thrilled when they reach out to Aging Together, but we
Yeah.
don't leave out those AAAs. And so I did want
Absolutely.
to
Yeah.
share a map with you all. All of the AAAs report up to our state office on aging. And so it's important that you understand there's 24 different AAAs in the state, that there's a similar format for this in every other state. So if you have a relative that you are providing care for in another state, they have an area agency on aging. Okay. I had a woman the other day who said, well, I don't know that you could help me. I live here in the Williamsburg area, but my mother lives in Houston. I said, I actually think I can. Let's go Google what is the area agency on aging in Houston. And we found that. And then she was able to reach out. So just had actually my son who drew the cup, his former English teacher I bump into regularly, his English teacher from middle school. She really helped him during a very challenging time being in middle school in the pandemic. Didn't go well together, and she was really instrumental in getting him through that. And I bump into her around town, which I'm grateful for. And she shared with me the other day, oh my gosh, I think you're involved in helping older adults. Can you help me with my parents that live in North Carolina? Said, yeah, tell me which county or city they're in. We'll figure out the area agency on aging and we'll start there to get you connected. So I just can't say enough about how, these are state employees, these are state funds that are targeted to be information and referral, and to connect with resources. And often the area agencies on aging are providing very specific direct resources, specifically in the home, and home delivered meals, transportation, things of that nature. So I've just listed several here. I think for many individuals, I think one of you gave an example. There are faith groups that are very involved in supporting older adults too. So thinking about connecting there. And then Ellen, I think you said Encompass is looking to provide the guide model.
Yeah,
Uh,
yes, they are now.
okay,
They're partnering, and yeah, I would say reach out to Janelle. She's on this call, or reach out to Encompass directly after the call. Yep.
great. So I'll just say Riverside is involved in the guide program too. It is guide all capitals, GUID, and it is a CMS, so it's a Medicare funded program that's in its second of 8 years of a demonstration to try to provide monthly touch points to persons living with dementia and their family caregiver. And even in some cases, depending upon the type of dementia and the severity or complexity of it, they may even, or you may even be eligible for respite services, a respite stipend. So there you can find a guide partner in a number of different communities. And it sounds like right now in your community as well. So we just encourage you to explore that and to actually celebrate that the Center for Medicare and Medicaid Services is kind of lifted this up and really has caregivers as a key focus. So I always encourage folks, if you're, I can't promise that when you go and talk to your doctor about your care or your loved one's care, that they're going to have a resource directory like the 95 pages that Ellen just mentioned, the resource guide. Many providers will tell you that's not their job to know what all the resources are. But hopefully, at least starting with the healthcare provider, especially if you're not feeling well or your loved one isn't feeling well, you can't quite figure out what's going on. We don't want to bypass the provider in that piece or our healthcare systems. Certainly, opportunities for transportation. That's where I would also reach out to my area agency on aging. Home delivered meals. Again, a resource often provided through our area agencies on aging. I've also heard some very positive experiences on mom's meals. So I just wanted to share that one. There's probably lots of others that provide nutritious meals that are prepackaged and shipped to individuals. That would be one example. Thinking about aging in place resources. And again, I'm giving you a lot, just kind of a quick overview here because I don't have time to dive into any of these. But I do find this interesting, I guess, conundrum. Caregivers will say, I need respite. And in almost the following breath, they'll say, I'm not sure what respite is. So um, I can share these slides or Ellen can provide the link and you can look a little bit more into an organization called Arch that really does a nice job of diving into what is respite. It means taking a break. Well, what does that mean for me? What does that look like? What are my options? Which are very, there are many different options. I mean, you wouldn't have a resource guide that's 95 pages long if we didn't have these kinds of options in the community, but sometimes it's difficult to digest that guide. So know the resources are there, but then kind of understanding what's best for you might be where you do need to talk to somebody on Ellen's team or somebody at your area agency on aging to help you kind of better drill down into some of those. What are my options in the community for assisted living? Where does memory care fit into that? What about nursing care? And again, we're not going to go into all the definitions of these, but it does take some time to kind of learn the distinction of these and to either do your homework or to lean on someone in these agencies who can help you learn the differences and determine what might be the best situation for your loved one. I will say there should be nothing embarrassing about saying, I don't think I can do this anymore. I need help. You're not giving up on your loved one and you're not giving up on your skills to be a caregiver, but you might have to say, I can't do this on my own and I can't do this in my home or in my loved one's home. And I need to look at a day program or a more sustainable form of community-based care in one of these settings. Okay, I've mentioned all of our area agencies on aging report up to our state office called the Department for Aging and Rehabilitative Services. Virginia Navigator is a wonderful clearinghouse for resources for caregivers throughout the state. You can search by zip code, by type of resource. AARP Virginia, very much focused on caregiving support. And again, I can provide these slides so that you have access to these links. And then nationally, as we wrap up here, do you need to know about how well a long-term care community is doing, how well they've kind of scored, what's their scorecard? You can do that through the elder care locator. I actually just did this for a gentleman who works within Riverside, and his mother's residing in a long-term care community in this area, and he's not real pleased with the care. And I said, well, let's go look up and see what the star rating is first. And then you come armed with some more information. And then let's also loop in an ombudsman to be an advocate for you. But you can see there are several, I didn't even list all of the national organizations that have just made it their mission to focus on caregiving. So while sometimes you feel like you're alone and no one can relate, I want you to know that there are local, state, and national resources that are working to learn about and improve your well-being as a caregiver so that you can continue to do what you're doing. There are specialized resources if you're caring for somebody who has Alzheimer's or Parkinson's or cancer or arthritis or diabetes, so lean on those organizations that know those resources best. And then I want to wrap up with, I love the image of the hands and that we're in this together. I don't view caregiving as one way. It's not you doing everything for this poor individual who can't do anything for themselves. I would encourage you to see this as a bi-directional relationship. Again, it may not always be equal, may not always feel like a partnership, but you're each learning from and giving in this relationship, and to keep the door open to filling your cup, and to being open to new resources. And whether it's something where you actually go to a community and or an agency and fill out an application to get help, or you try an app online or something in between, that there are a lot of different resources out there for you. And I know we're getting close on our
Yeah.
time here, but I will pause and thank you for listening and hoping, while I couldn't see your heads nodding, hoping that was beneficial to you and you
Well,
learned
that
one or two nuggets you can take with you.
Well, I definitely did, Christy, but I always do listening to you. And I just think that that was just a wealth of information and really, really, really great.
Did you
Patricia,
get
yeah,
the link to the video library? Did that get dropped into the chat?
I haven't seen it yet.
Okay, and it may be that my colleague hopped off before she was able to do that. Would it help if I
Um,
put it in the chat, or would you like me to add it to one of the
yeah, good.
slides? And then if
Well,
you
good.
sent the
Oh,
slides
yeah,
out,
yeah,
you'd
do
have it.
that. And then I can
Okay,
send the slides out, but make sure everybody, lets me know if I need your email address, so I can send you the slides. But Christy, is it okay to put the recorded presentation on the website?
absolutely. Yes.
Okay,